everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews here in Birmingham, Alabama today with John Lanier, Maynard Nexon healthcare attorney. Good to be with you.
Good to see you again.
We are delighted to have joining us today leaders with Baptist Health System and Orlando Health. Amy Allen, she serves as president and CEO of Baptist Health System, and Thibaut Van Marke, he serves as senior vice president of Orlando Health. Thank you both for being with us.
Thanks for having us.
Thanks for having us.
Thibaut, can you start us off by talking about Orlando Health's mission and your specialties in the healthcare system?
Yes, certainly. So Orlando Health is a 100-plus-year-old healthcare system located in Orlando, Florida. Our mission is to improve the quality of life and health of the people and communities that we serve. And like I mentioned, we've been doing that for 100-plus years. Starting as a standalone hospital and as Orange Memorial Hospital in downtown Orlando in the early 1900s, and now expanding across Central Florida and now into Alabama. We also have some facilities with ownership in Puerto Rico.
Well, tell us just a minute about the reasons for choosing one another as partners. Last year, the Orlando Health Baptist Health System deal was announced. So I'll start with you, Amy. What was your reason in thinking about this deal and Orlando Health coming into the Alabama community?
Sure. As a tenant let us know last year that they were looking to sell out of the joint venture. And in the joint venture documents, we actually had the right to approve or deny who our new partner was. And so it was very important to us that we brought a wonderful partner to Birmingham. And so we did a lot of due diligence and research on Orlando Health. We knew that they were going to be the manager and operator for hospitals. So we wanted to know that they delivered high quality care. We wanted to deliver high-quality care for our patients and our communities, and we saw that they did. They had delivered award-winning care, and so they were able to check that box. Also, they had consistently been awarded a best place to work, and so that's something that we really wanted to provide for our team members. Their physicians were very engaged and very happy and had great things to say about working at Orlando Health, so that was also important to us. We felt like with more engaged employees and physicians that our patients would benefit and have a better experience. They also were committed to investing in our facilities and improving the physical plant, and that was important to us, but also had a strong balance sheet. And when you're looking for a capital partner, not only do you want them to be willing to invest, but they need to be able to invest. And so that was really important to us. Also, and probably most importantly, they're nonprofit. And we felt like our missions were more aligned. And although they're not a Christian organization, we are a Christian organization. They were committed to maintaining our faith-based culture. And so we really couldn't find a reason not to partner with them.
Great, thank you. Thibaut, what was your response in coming into the Alabama market?
Yeah, it's interesting. A lot of what Amy just mentioned as to why Baptist Health System liked Orlando Health are a lot of the same reasons why we liked Baptist Health System and why we liked Birmingham. We've been on a growth trajectory for better part of the last decade. And I kind of mentioned that a minute ago in terms of our growth across Central Florida. We now have hospitals ranging from St. Petersburg, Florida, all the way to the East Coast of Florida. And expanding that growth outside of Florida has been something we've been looking to do for about 7 years now. And we really see ourselves as a player in the Southeast United States. And so we've been looking for the right opportunity in the right market for a better part of 7 years. As you might imagine, those opportunities don't come every day. And acquiring a hospital, is not terribly interesting. Being able to have an immediate presence in a market was really attractive to us about this opportunity when we connected with bankers who were facilitating the deal. So once we identified that the scale made sense, then it really became, do we have the right partner, and does the geography make sense? As I mentioned, I think all the things that Amy described around culture and being able to have a positive impact on patients and our communities, being able to have the ability to develop service lines, we all saw those as opportunities. We liked Birmingham as the market. If you look at the southeastern United States, a lot of growth, in that overall geography. Cities like Atlanta and Nashville, Charlotte, Raleigh have all been high growth areas for in some cases, better part of the last couple decades. So you project out long-term growth, not over the next couple of years, but over the next several decades. And we feel like Birmingham is really well positioned to do that. And we want to be a part of that story. I think the last thing I'll mention, you led by a question about our mission. Being here serves our mission. We have a really good track record in where we've expanded, in the communities that we've expanded, of being able to improve care, improve access to care, bettering work environments for our caregivers, nurses and other healthcare providers and physicians, and we feel like we can make that similar impact here.
Yeah. This next question is for both of you. Amy, maybe we'll start. What will it look like for patients and providers as you work this out together?
Sure. I think what our expectations are is that as community members, I think you will pretty quickly see changes to our facilities, improvements to our facilities. I think that will be noticeable. I think you will see over time, my expectation is that we will be the best place to work. I mean, that is my expectation. So I think the patients will see and feel, a more engaged and a happier employee, team member, physician. I think ultimately they'll have a better experience. I think the community, if you're not a patient, I think as a community member, you'll notice the changes in our facility. I think you'll see more marketing. I think you'll see our name out there a lot. You probably already have. We changed our name to Baptist Health and did a lot of marketing around that recently. And I think you'll see our hospitals be more active and involved in supporting the community.
Yeah, I think delivering great outcomes and great care and developing comprehensive service lines, it all starts with culture and having a desirable place to work. So that's something that we've already leaned in, and we want to create a differentiated employee experience. I think to Amy's point, we have multiple facilities on our Orlando markets that have been designated by various organizations as the best place to work, and that's certainly going to be one of our objectives. I think how we partner with physicians is really important to that too, right? So care feels different for patients when they feel cared for and about, right? So they expect good outcomes, and certainly we will lean heavily into that. There are a number of outside rating agencies that rank hospitals and grade hospitals, and we will seek those designations at the highest level to be able to share with our communities, give them the confidence that the care that they receive is good. But that's table stakes, right? That's the starting point. How they feel once they enter our facilities is really what differentiates the experience and creates loyalty with patients, and that culture is what's going to help us do that.
Following up on that question specifically, Thibaut, what are some key areas of focus that you see Orlando Health bringing into our community, our service area for patients in the state of Alabama?
Yeah, I think it's a really good question. One is I think we want to build on the things that we already do well. So there's certain areas of strength, I think, for our hospitals, women's services at Brookwood Hospital for one. We have outstanding cardiovascular care at several of our facilities. I think what's a little lacking right now is the coordination of care. Historically, these facilities have been run like 5 independent hospitals versus a cohesive system. And so we want to be able to give patients the confidence that you can have access to care in your local hospital, but if you need a higher level of care, we can fill that gap too. And so what our initial progress is really around starting a strategic planning process that will help define not just what type of care we provide, but how we provide it and what that continuum of care looks like across our 5 hospitals, but then also in the outpatient environment. And so over time, I think what you will see is a link between the Baptist Health brand of hospitals and physicians and ambulatory facilities, but a link to a comprehensive service line model. So think cardiovascular services, neurosciences, women's care, digestive health, orthopedics, to name a few examples. And so the idea then is not that you just show up to your hospital to get the care. The idea is that we have the full continuum of care represented, so that whether you need to be in the hospital or not, you've got an understanding of what resources are available to you to get support.
Great.
Along with resources, Orlando Health also has a history of research, pioneering research. Thibaut, if you could talk a little bit about, I think it's pediatrics and adult trauma. What does that look like? Will that continue?
I guess the answer is it depends on what the market needs. I think we're not going to do things just because it's something to do. We're going to do things because it's what the community needs. And so there may be some of those areas where, the need's already met in the community. So then how do we enhance that versus duplicate it? But research and I would say education have been a big part of how we do our work in Orlando. We do graduate medical education here in the market already. And so I think we have opportunities to take the best of what we do here, maybe learn from some successes that we've had in Orlando and figure out where there's opportunities to create some synergies. Specific to research, this is another area where I think creating more clearly defined service lines helps. When you have multiple independent practice models, there's really not a great pathway to do research, to collaborate with industry on product development, that sort of things. And I think through our service line infrastructure, we've been able to engage in both of those in our Orlando market and hope to be able to do some of the same here and also identify where there's opportunities for collaboration between the care that's provided in Orlando and the care that we provide here as well.
Sure. Thank you.
Yeah.
This question is for both of you. In the changing landscape of healthcare, you hear a lot, read a lot about technology, but also AI. What innovations do you personally think are going to be something employed in the next 5 to 10 years? Think you see healthcare in this area for your system going in the next 5 to 10 years?
We're still very much in the emerging phase when it comes to understanding how AI is going to influence us, right? So, like in the professional world, people are starting to figure out hey, how does it help me write a better memo, or how does it, help me communicate better? I think in the world of healthcare, there's a couple different areas. On the, I'll say technology and device side, I'll think about like robotic surgery, for example, is starting to leverage artificial intelligence to help inform the surgeon on how how to where to go for their next cut, or how to make the right decision in the surgical environment, and so that's already in place, right? And so you've got the manufacturer, the device companies, and the technology firms that are already kind of engaging that and trying to figure out how to help there, and how to create a differentiated product that reduces variation. I think we're also seeing it in the imaging space as a support level for radiologists, leveraging AI to help on that front. We're not seeing a replacement, and I don't know that we see a replacement of healthcare givers. I think we see as an enhancer, and I think we'll continue to see that. The other area is really with our electronic health record, and I'll say decision making for physicians and in the hospital environment as they as different data points come into a patient's condition, support to help get to the right decision maybe a little faster than we're accustomed to. Like
clinical pathways.
Yeah, that's exactly right. And I think what will be interesting over time is, healthcare has depended heavily on intellectual knowledge over time, right? The training and education that our physicians and nurses and other healthcare providers receive to make decisions. So it's going to be a transition over time, right? To be dependent on AI or other technologies to help make better decisions versus, and so part of that's a change of mindset for folks as well. At the risk of being a little bit of a broken record, again, that's where getting people to work together, defining service lines, and a more global approach gives you more access to being on the front end of those emerging technologies. We want to be part of that. We want to help inform how those decisions are made so that they can be done safely and with the best interest of our patients in mind. And so we're excited about being part of that process.
Absolutely. Amy, your thoughts?
The only thing I would really add is, there's a pretty significant nursing shortage right now, and we don't really see any relief to that in sight. It's national. So while I don't expect it to completely replace nurses, I think it will have to be utilized to significantly enhance, because that's the only way I think we're going to solve the nursing shortage, and I think ultimately that's how we will solve it.
Very good.
Well, it's clear that you both have put a lot of thought into this partnership, and I see a level of excitement from both of you, which is nice to see. On behalf of everyone here at Taking the Pulse, we thank you both, Amy and Thibaut, for joining us today, talking about this. Love to have you back in 6 months to talk about some wins and some surprises, maybe some insights that you get along the way.
They would love that.
That would be great.
Yeah.
Okay, wonderful. For those of you who joined us, I hope you enjoyed this conversation about a new partnership between Orlando Health and Baptist Health System. And we look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.